Although I still have a lot of hope to be able to walk again once I have some better treatments and symptom management. And that just kind of shows like it can fluctuate. There should be like in med school specifically, like at least a semester on under researched rarer illnesses. But luckily, I have a really great support system that I am so incredibly lucky to have.
So hi everyone, my name is Elinah and I'm the founder of Teen Med Spot. So today we're gonna be interviewing someone with Ehlers-Danlos syndrome. So if you can tell us a little bit about yourself, that would be great.
Yeah, my name is Nikolena. I'm 19. I was an EMT and I danced for about 10 years before my EDS progressed too far. I have classical and hypermobile EDS. Now I'm an intersectional disability advocate. I advocate for people, with my similar conditions as well as other disabilities. I'm also part of the queer community, and I advocate for people of all minorities and marginalized groups. I have, like I said, I have CEDS and HEDS and roughly like 17 comorbid conditions, which include like dysautonomia related things, neurodevelopmental things. I have a seizure disorder and a lot of other things too, because EDS has a lot of friends.
Yeah, okay, thank you for sharing that. So for those who may not be familiar, what is Ehlers-Danlos syndrome?
Ehlers-Danlos is a group of 13 and possibly 14 genetic connective tissue disorders. It's caused by genetic mutations that affect the structure of the connective tissues in your body. Each type has its own set of traits with clear diagnostic criteria, but some features are seen across all of the types, like joint hypermobility, skin hyperextensibility, and tissue fragility.
Okay, yeah. So there are multiple types of Ehlers-Danlos syndrome, as you said. So could you explain which type or types you have and what that means for you?
So I have hypermobile as well as classical. Hypermobile is the most common type. It's when you hear people talking about EDS, a lot of the time they're going to be talking about hypermobile specifically. For me, like the main things with my hypermobile is, hypermobile joints, it's in the name. I injure really easily, which is also a big thing with classical. But I have, oh my God, my brain just went blank.
That's okay.
Wow, what symptoms do I even have? Brain fog is one. This is a prime example of brain fog. My brain will just go totally blank out of nowhere, and I'm like, oh, do I even know words anymore? But the joint issues, I have a lot of chronic pain. I have a lot of GI problems that are related. Classical and hypermobile have a lot of overlap. But with classical, it has a lot more effect on like types of scarring. So there's, I believe it's called atrophic scarring, and it is essentially like when my skin is really fragile, and so it breaks easily. And when it does, and it scars. Essentially, there's like a thin layer that they call like cigarette paper, like that did heal, and then underneath it's essentially like not healed. And so a lot of the time I have had scars like reopen, which is like just an insane thing to say. But it is the reality for a lot of people, specifically with classical. Yeah.
Yeah, okay, thank you for sharing that. So when did you first start noticing symptoms of EDS and what was your journey like with that diagnosis?
So I have dealt with symptoms my whole life. It is something you're born with. Some people don't have really any symptoms until like puberty or even later sometimes, but for me, I've always dealt with symptoms. When I was younger, it was mainly injuries, autonomic dysfunction, and pain. I was always the kid wearing some type of brace. I was on and off crutches until I needed them so often. I finally got my first pair of forearm crutches in 2020, and a little before that is when my health started to steeply decline. I ended up moving from where I was living in Virginia to another state, which I'm not going to share what state I live in, but another state. And so that move complicated my care because I was going to a totally new place. And it took a while to establish care, but my first like official diagnosis was MECFS, which for anyone who doesn't know is myalgic encephalomyelitis. also chronic fatigue syndrome. It's way more than just being tired, but that and also fibromyalgia. The next diagnosis I got was Lyme disease with co-infections. I grew up playing in the tall grasses of Virginia, and I've been bit by so many ticks, so many times that like it's impossible to count. And it wasn't until I was 15 years old that we found out I had Lyme disease, and by then it made treatment very difficult because it had been so long. Lyme is ridiculously stigmatized for some reason, and it's made accessing care a lot harder, as there are so many providers who like think it isn't real or it's some mental problem, and my Lyme complicates my EDS and contributes to my degeneration. So after like so many years of fighting, I got my HEDS diagnosis, and then a few months ago, I finally got my CEDS diagnosis, and among so many other comorbidities along the way. One of the hardest parts was my gastroparesis diagnosis, which is when your stomach is partially paralyzed. It just does not digest food efficiently, and food just sits in my stomach. And so now I have a GJ tube, which is a tube that goes into your stomach and then through your intestines to your jejunum. And that was like so hard to get. It took me literal years, and I only got my tube because I was unfortunately quite literally dying and was on death's door. And it's like really unfortunate because that's been a common theme, and it is for a lot of people with EDS. Like you have to be dying enough to get treatment, which is really disheartening and defeating and obviously dangerous. But the degeneration involved with my presentation has honestly been really scary because, again, it's degeneration. It gets worse as you get older. And that's low-key, high-key terrifying. But luckily, I have a really great support system that I am so incredibly lucky to have. And so I've been able to persevere in the face of medical gaslighting, misdiagnosis, and like genuine malpractice. So I'm very lucky for that.
Yeah, that's great. You have a good support system for that, because I know that can be like terrifying. I understand that. So what are some of the biggest challenges you personally face living with EDS? I know you already kind of went through some of that, but you know.
Yeah. So honestly, the biggest one, which sounds like, well, yeah, obviously, but it's accessibility, especially access to care. As I kind of mentioned, it's hard to get actually taken care of by providers. It's partially because there's like such little research on EDS, and what research there is really limited and doesn't touch a lot on some of the rarer types. And also a lot of providers just don't really care to learn about it, which has led to me being told so many times I'm too complex. I've also been told that it's anxiety or it's somatic symptoms, and all sorts of like just blowing me off. Again, medical gaslighting has been a hard thing. And then also there's like the physical aspect. I have so many different symptoms. Personally, I'm a full-time wheelchair user. I am unable to walk, and that is due to the fact that I have POTS, postural orthostatic tachycardia syndrome. And also because of my CEDS, my joints are really unstable. So when I try to stand, my joints go out from under me, and then I lose consciousness. Not super ideal. So being a wheelchair user is obviously difficult because places just aren't accessible. And then, you know, I have a lot of light sensitivity and things like that, and that also complicates things. So accessibility is really the biggest thing.
Yeah, we definitely had some of our other interviews kind of talk about that as well. You kind of also talked about this question as well. So how has EDS impacted your daily life?
Yeah. So honestly, an easier question is how does it not? And the answer to that is it impacts every single aspect of my life. I mean, obviously, we talked about walking. I can't do that. I am currently unable to work. I do TikTok. I have a community on TikTok, and I make like the tiniest bit of money off of that, but that is all I'm able to do. Also, hobbies. Like I said, I used to dance. I can't really do that anymore. But I still do like watercolor and things like that. So I still am able to do some things, but it directly affects that. Also, like eating and hydration. I'm mostly tube fed. I have a port for IV fluids. And then also my time, because I'm constantly at doctor's appointments or I'm making phone calls for doctor's appointments. And it's like everything, you have to constantly think about it. There's always something. And then also like socialization. I've lost a lot of friends due to being disabled, but I've also gained like so many more because of the community I've built and found surrounding it. And then there's also like the mental health side. There's a lot of physical comorbidities with EDS, but there are also a lot that can be like mental health or neurodevelopmental related. One of them is autism. I'm autistic. And obviously, people can imagine how that affects your social interaction and other interaction with the world. I also have OCD, which plays into it, and things like that are really common comorbidities with EDS. Yeah, so that's a big impact.
Yeah, I understand that. So, this is just for our viewers. So, what do you wish more people understood about EDS from a patient's perspective?
Yeah, so namely that EDS is a group of 13 types. And each can have essentially infinite presentations. While the again the hypermobile subtype is typically the like most highlighted one because it's most common. The others are varying degrees of rare, but none of them are too rare to care about. Personally, like I said, I have hypermobile and classical, and even those who have heard of EDS typically have no idea what classical is, and it's not even the most rare type. Another thing is that there's no cure. It's something you're born with, it's lifelong, you're always going to have it, you're always going to deal with it. Although, that being said, there can be a lot of fluctuations in presentation over time because it is a dynamic disability. My EDS was significantly worsened when I had heat stroke almost a year ago now, and that's why I'm a full time wheelchair user. I started using wheelchair part time in 2022, but then because of the heat stroke, I became full time. And although I still have a lot of hope to be able to walk again once I have some better treatments and symptom management, and that just kind of shows like it can fluctuate. There's still degeneration, it still gets worse, but it can go a little back and forth. Also, another like really big frustration is society always expects people to be pushing through and inspirational and fighting and positive, which just like isn't realistic, nor is it like safe. Like toxic positivity is such a harmful thing, and I have a lot of people being like, you're so strong, you're so incredible for doing this, you're so inspirational, like wow. And it's like, well, I don't really get a choice. Like, yeah, it has made me stronger in some aspects, but it's also made me a lot less strong in others, mentally and physically. And like, I don't know, it's just really tricky, especially, and people will be like, oh, I hope you get better soon. You got this, you can beat this. And it's like, well, I can't though. And people have good intentions when they say things like that, but unfortunately, that kind of attitude of just like pushing through and being inspirational, like I said, is harmful. Like it can cause people to have worse flares and worse symptoms and stuff like that. There's essentially just a lot of understanding about what it's like truly living with it. A lot of people will compare EDS to a full-time job, or like chronic illness, rare diseases in general, to having a full-time job. But honestly, it's so much more than that. You don't get a break, you don't get days off. It is constant.
Yeah. Yeah. So, yeah, that's really inspiring to hear. Yeah. And I understand that, people are always telling you to push through, encouraging, but like you kind of don't have a choice as well. So
Exactly.
that makes
Exactly.
sense. Yeah. So, what changes would you like to see in how doctors approach EDS awareness or just EDS in general?
Mm-hmm. Yeah, so EDS is so multifaceted because of the comorbidities that come with it. There's never just EDS. And so that really limits providers that people can see, as I kind of mentioned. People are frequently called too complex. And so maybe a few of the comorbidities individually, like say asthma or something, might be more well known and easier to get treated, but a lot of the comorbidities are not well known, and when you have them all at once, then that makes it a lot harder for care. So having things like structured education for the structured education for providers, as well as continued wow, I cannot speak today.
It's
Another
okay.
another symptom of EDS. But having structured education and continuing education related to, like, rarer, under researched illnesses, again, specifically EDS, as well as like incentives to be more knowledgeable on these would be huge. It's also hard to obtain treatment because, doctors either don't care to learn about it or are completely ignorant of EDS, especially the rarer types, especially. So having providers who directly specialize in like chronic illness support would be literally life-saving for so many people. There just really isn't a space for patients like me in our current medical system, and that has to change. Better than bad feels good when you're used to completely terrible, which is just like the reality for so many people like in my shoes. So, that being said, simply a lot more openness would be massive. I've seen it more commonly with some younger doctors recently, but if providers like simply just took their patient's word more seriously and listened to them and about like their life experiences, it would make like a world of difference. I also think there should be like in med school specifically, like at least a semester on under researched rarer illnesses, because there just isn't. If we're lucky, providers get like a lecture on what we have. Also, better access to mental health support and proper time off is so incredibly important, because when there isn't that avenue, it leads to burnout, which then leads to something called compassion fatigue. And compassion fatigue is essentially when your ability to be compassionate becomes fatigued and you get a kind of resentful of patients. I got more education on compassion fatigue as in EMT school than most doctors ever will, and that's a really big problem. If it weren't for the people around me who have helped me advocate and my community, the effects of compassion fatigue would have cost me my life. Providers cannot provide care if they themselves aren't cared for. So that's another big component is a mental health aspect for providers.
Right. Yeah. We actually had a lot of people said that they were like, if doctors kind of just listened and had compassion for
Exactly.
people, because I feel like they're just so used to seeing these people with like other diseases that are more commonly known. And
yes, yeah. And they so many providers just like go by textbook, and it's like, I'm sure you've heard, but the term zebra. So when you hear hoofs, you think horses, but a lot of times you have to be like, wait, it could be zebras. And like doctors just need to start thinking outside of the box and not just go based on the book in front of them, because the book in front of them is just a book. It's not their actual patient. And so if more providers again just listened and like looked at the patient in front of them and had more openness and understanding, again, world of difference would be made.
yeah, and I definitely everyone so far has said just for them to listen to the patient and not the
Which,
textbooks. Like,
yeah, and you would think like, oh, duh, you have to listen to your patient. They're right in front of them, right in front of you, but they just don't seem to want to do that, especially with younger patients and patients who are women or queer or patients of color. Any patient in a marginalized group, like disproportionately, is going to get worse care, which is really, really sad, and really unfair. Again, I'm part of quite a few marginalized groups, and if it weren't for my community, I probably wouldn't be here because I wouldn't have been able to advocate for myself, because you just don't get taken seriously and listened to, and it's really sad.
yeah, and I think that's just like one big thing about
Yep.
having an underrepresented or under-discussed condition for like anybody in general. So it's just. But so, what do you think could help improve awareness or understanding of EDS or any of like the conditions that you have?
Yeah. So again, education is like the biggest thing. If more doctors and other providers have knowledge on it, the education and understanding the general public will also increase. So if rare illnesses as a whole were discussed in schools, like in a science curriculum or something like that, it opens avenues for more people to learn about it, especially EDS, obviously. The data is really hard to determine due to lack of research entirely, but between onset of symptoms or like when an EDS patient begins to seek diagnosis, it frequently takes 10 to 15 years, which is just like insane because there are like, you can do genetic testing for most of the types, and for the ones that don't show up on genetic testing, specifically HEDS, it's based on clinical presentation. It's not that hard to diagnose, but because of the lack of education, the lack of access, all the different things I've talked about, it takes so long. And the 10 to 15 years is an average based on what we know, but that doesn't include all the other people who haven't been diagnosed and who have no idea because of lack of access and that type of thing. So, better and earlier genetic screening and hypermobility screening would also be really helpful. Like, I really think that when babies are born, they should get a full genetic panel of a wide variety of things, because like, had I had earlier diagnosis, like if I had been diagnosed when I was, say, 10, I could have avoided so many injuries. Again, I was a dancer, and so my hypermobility was great. I'm flexible. It really benefited me, but because I didn't know why I was flexible, I ended up injuring myself all the time. And now I have like permanent damage. And then I would go to physical therapy for that. And they didn't know what EDS was or that I had it. And so the type of physical therapy they were giving me also damaged it more.
I definitely get that. Again, it just tracks back to, doctors listening, or just, actually getting to know about these rare diseases and all of that.
Yeah.
So,
proactive too.
Yeah. So just one more question, just for all of our viewers and for people maybe exploring an EDS diagnosis, because we do have some people who are getting tested now. Like, do you have any advice for them? Anything you'd like to say?
Yeah, you got this. It's really, really hard. Um, it's really hard, but you have to keep fighting and advocating, because you will get there. You will get there, and it might take a long time. It might take 10 to 15 years. Try to find community. There are so many communities online. Support is so life changing. But you got this. You're gonna make it work. It's gonna be okay. It's all okay in the end. And if it's not okay, then it's not the end. You got this.
Thank you so much for sharing that, and thank you so much for participating in this interview. Yes, people have been waiting for more interviews to come out on YouTube, just so that they can get like a better understanding.
Yeah, I'm so grateful to have been able to contribute. So
yeah, thank you so much. And that concludes our interview. So thank you so much for participating and taking the time out of your day to just come over here and talk to me, and and just inform all of our viewers. So yeah,
if you ever need like anything else from me related to this, please do feel free to reach out. Yes. Because I love being able to advocate for these type of things, because there just isn't anyone doing it, so we got to do it for ourselves.
Yeah, so thank you so much for attending today, and I hope you have a great rest of your day.
As well.
Bye.